everyone. My name is Kelsey Friesen. I'm a master's student studying occupational therapy, and I've been working on a project with Dr. Tim Bartlett. He's an assistant professor in the Department of Occupational Therapy. So we've been working on this project since September 2021, and we're just about to start our in-depth data analysis, meaning we're just going to start our fancy process to figure out what our data means. So we're examining how occupational therapists in Alberta engage in truth and reconciliation. And I just wanted to note, I wish that I could be with you all in person today, but I'm really grateful that the organizing committee is still giving me a chance to share this work. So just before we get started, I just wanted to give a little bit of an overview. So I'm going to talk about our study, but first I'm going to introduce the Sustainable Development Goals, or the SDGs, that the study is relevant to. So after that, we'll get into why we're doing this project, how we're doing this project, what we've seen so far, kind of based on initial review. And then I'll wrap everything up by talking specifically about how our study contributes to attaining these SDGs and quickly talk about kind of what we see as possible outcomes of this project. So there are 17 goals in total. This first one is number 3. So it addresses good health and well-being, and also how that good health and well-being, how they interact with each other. So over the last 10, 30, 100 years, obviously there have been major improvements and advancements in healthcare. But that said, one of the issues is that not everyone has access to that care, especially those living in rural or remote communities. And the Government of Canada actually released a report in 2018 talking about not only that, but also about the significant health inequalities present amongst Indigenous peoples and how those inequalities lead to further risk for certain diseases and other health conditions. So then we have number 10, and this one is specifically focusing on reducing inequalities through laws, policies, practice, any way that you can. So we know that there's been progress again in healthcare, education, all other areas, but we also know that it's often come at the expense of, for example, marginalized groups like Indigenous peoples through colonization and discrimination. So an example of that might be the experimental medical procedures and trials that our government tested on Indigenous peoples way back, not even way back. But. So when I'm thinking about these goals, I'm thinking about how can I, as an occupational therapist or a future occupational therapist, as well as my colleagues, address these. So the Canadian Association of Occupational Therapists, or CAOT, they released a statement also in 2018, which in some kind of gives a list of calls to action for therapists, talking about how they might bring truth and reconciliation into practice, some of those things being done at the individual level, and then others being done within the entire OT community. So then we also have CAOT, or our Alberta College of Occupational Therapists, and they've said, and they have it listed on their website, although it's kind of hidden, but anyways, they say that they are supportive of CAOT's statement, and they endorse the calls to action provided in the document. So this kind of is where we got our research question. We are curious about our associations and our governing bodies talking about the importance of improving the healthcare system provided to Indigenous peoples by OTs, but what are OTs actually doing right now? So that's exactly what we were looking into. So that obviously our research question, how do occupational therapists practicing in Alberta engage in truth and reconciliation? And to kind of explore this and figure this out, we decided to do interviews with OTs. So we were aiming for 10 minimum and 15 maximum. I ended up doing 11 in the end. The eligibility criteria for participants, exactly as you see on the slide, just that they've completed an accredited OT program and that they're currently registered to practice in Alberta and that they're in good standing. So no requirements for years of experience or anything like that. So this is who we ended up with. We had 10 of our participants. They studied OT in Canada. Just as a note, 9 of 10 of those were from the same university, so there's a little bit of a skew there. But we also had one person that studied in the UK. But that said, all of them are licensed to practice in Alberta. So we have graduation dates ranging from 2009 to as recent as last year. And the range amongst these graduation years kind of offered a little bit of insight when it came to things like curriculum changes, or more so lack of curriculum changes, when it comes to working with groups that suffer the consequences of that exclusion and marginalization that we were talking about with the SDGs. And then just as another note, I didn't include it on this chart, but I just wanted to note that participants were exclusively female. So there are less male OTs in general, but they are out there, and all of the ones for the study were female. So we've got our preliminary findings here, just what we found kind of off the bat for informal analysis. So this first one, we have expressive interest in pursuing a practice that engages with truth and reconciliation. So OTs are interested in doing this. And this is demonstrated by a couple of the quotes I have down here. And obviously there are a ton more, but I just picked out a couple of examples. So Desiree was talking about how there's no way that they think they'll ever understand what it's like to live as a survivor or as an Indigenous person, but they're making conscious attempts to learn. So to learn, that's that interest in pursuing that practice. And then we also have Abby, who says they feel like a bit of an outsider, and they're trying to come up with activities for clients to do, activities that are specifically a little bit more culturally appropriate. They want to learn to do these directly from an Indigenous person rather than themselves. So pursuing that interest outside of maybe just their practice. And this kind of really weaves into the next theme that we've found. And it's despite that individual motivation that we're talking about, so to learn and to do these things, there are so many social and institutional barriers which create difficulties in bringing truth and reconciliation into practice. So we have Adrian here, and they express, is it really realistic for your average clinician who's working in a system where resources are constrained to do all these things in their work time? And time is something that came up with every single participant. As we know, our healthcare system is arguably in a state of crisis. So time available to spend doing things outside of whatever they have to do already with clients is very limited. And there's interest in it, but they don't feel like they have time. So, and then we also have an OT who works in a rural community, or I guess they live in a city and they visit rural communities. But they talked about how they're in and out of communities all the time, and how they might visit a small community only once, twice a year, and that all that they have time to do in those that once or twice a year, those visits, is just kind of do a quick assessment and then throw recommendations at them. So you're not really following up, you're not kind of seeing how they're going. Lots of issues with that. So that's a really big barrier. And then we also have this willingness to try, but feeling unprepared. So also kind of weaved in from the last ones. I brought Addie in here again, just because I thought that what she said there was relevant to this as well. So feeling like an outsider, but not having the resources to do these things the way that she wants to do them. So feeling unprepared to do that. And then we also had Chantel, and they said that sometimes they feel like a bit of a fraud because they're white and they're trying to tell all of their clients to do these things when they have no idea what actually matters in their life, what the circumstances are, so many things. And then the last one that I'm going to talk about is the lack of education provided in both the formal education system, so university, and then also the workplace. So as we see here, there was no formal education, says Abby, or when I was in school, I didn't learn about these things, and so on. We also had Adrian at the bottom saying that they would love for their employer to invite and pay someone from a local Indigenous group to provide some education around traditional teachings and how you can incorporate that into practice. So those were our kind of 4 initial findings. Obviously, there are going to be a lot more coming once we do the formal data analysis. And yeah, I'm excited to see where that goes. But kind of wondering now, what does all of this mean for occupational therapy? So we've done this work, and now what does it mean? So obviously the study isn't done yet, and there's going to be findings aside from those 4 that I just talked about, but this is kind of what we're expecting for the participants and for us. So we want for participants to think about how and if they bring truth and reconciliation into their practice. And then we're hoping that that reflection positively impacts their practice. So then, of course, our job is to figure out what's being done, what's not being done, what makes this engagement difficult for therapists, so those barriers that we talked about earlier. And but if we think back to the two SDG goals that I talked about earlier, number 3 and number 10, and I don't have time to cover every single detail about how they're interrelated, but I'll briefly talk about it. But with goals 3 and 10, we see a relationship within and amongst those two goals together. So figuring out what OT is or is not doing and why those things are being done might help us to see those gaps in the healthcare provided. And participants maybe even have ideas about how to, if not close the gaps, at least narrow them and work towards closing them. So one of the calls to action for this goal number 3 includes recognizing and supporting Indigenous health practices and respecting and addressing Indigenous people's needs. And that's hopefully what some of the OTs I talked to are doing, exploring what is or isn't done, and then using Indigenous peoples themselves to tell the story and to help close these gaps. So the preliminary analysis showed a lot of expected things, like how there was no education about providing Indigenous people care, which I really was not surprised about based on my own program and in talking to people in other programs. And then, so there was no education talking about that, let alone acknowledging the inequalities in the first place. So I'm pretty excited to dive into the data in the next month or so when I finish this clinical placement that I'm on right now. If you're interested in hearing about what I find when I actually complete the project, feel free to email me. My email is listed there, and I can keep you up to date. And that is all that I had for today. So thank you again for listening, and thanks again for the organizing committee for allowing me to do this virtually.